Pam Hartzell. I'm the Diabetes Care and Education Specialist and Director of the Diabetes Health and Wellness Center here at Memorial Hospital. I'm here today to talk to you about what we call the cool factor of diabetes self-monitoring, otherwise known as continuous glucose monitoring or CGM. CGM measures glucose continuously. It's by a tiny sensor about the size of an eyelash, and it measures glucose actually now 1 to 5 minutes continuously across the day. It's just one of the sensors that you can wear with the transmitter. It's very tiny, and then when it is on the body, it is waterproof. You can go on about your day, you can shower with it, you can swim with it. Glucose is displayed on a reader or your mobile device, your smartphone. Continuous glucose monitoring will give you information about if the blood sugar is steady, which is what we are wanting, or if it's fluctuating. And also not only the fluctuation, but at what rate, what speed is it rising, or at what speed is the blood sugar dropping. I think of glucose monitoring, the finger stick glucose monitoring, it's sort of like a snapshot of what the blood sugar is at the time, whereas continuous glucose monitoring is like the video. It will let you see the big picture and connect the dots. So even if somebody checks their finger stick blood sugar, let's say up to 4 times a day, you know what it is 4 different times of the day, but you don't know where it's been, what it's been doing between those 4 points. And it's very helpful information when you're trying to look at patterns of blood sugar. There are different forms of continuous glucose monitoring. There's personal CGM, personal continuous glucose monitoring, and that is where somebody owns the device. And then also there's professional CGM, where we own the device. It's kind of like a loaner program. If you want to just see what it's like to wear a sensor, you wear our device, and then we can evaluate, look at blood sugar, and you can see as well if there are any patterns. Because then you can troubleshoot if there are any patterns to either adjust your lifestyle, various things that you can do to affect the blood sugar, and then also healthcare providers, your doctor can more precisely adjust medications. CGM can help provide you with information to make the very best decisions in your diabetes self-care. CGM systems are not created equal. There are many different aspects that I would like the opportunity to be able to talk with you about. There's different sensor wear time, there's different features. Some of them have alerts and alarms so that you can, with your provider and myself, we can set so that if your glucose goes below a certain level, you would receive an alert. And then there are alarms, so if the glucose is falling quickly, you would know that and then also can take some action. Without continuous glucose monitoring, it's very hard to know that until the glucose crashes and you're having all these symptoms. Really have the technology now to prevent that. So if you're interested in having a personal CGM, prior to that, it is such a good idea for you to have all the information. I can help you with understanding what is available, and then also help you in deciding, along with your provider, what system might best meet your needs. Then also would like to just wear one to see what it's like before even going that far with personal CGM, you can wear one of the professional CGMs and get the same information, but get a feel for what it's like before purchasing a system. Again, my name is Pam Hartzell. I'm the Diabetes Care and Education Specialist. I would look very forward to meeting with you, discussing what your options are for continuous glucose monitoring, and I look forward to talking with you more.